The beating of a heart, so powerful and awesome that it becomes the rhythm of life. I'm Sandy Freeman, and welcome to Prevention's Smart Heart. Everyone knows someone, a friend or a relative, who has been afflicted with heart disease. It's the #1 killer in the U.S. Today, more than 5 million people are being treated for it, and many more don't even know they have it. Nearly 700,000 will die from it this year. The irony is that in many cases, heart disease can be controlled or even prevented. And that's exactly what we're here to talk to you about. We're going to be visiting with some of the country's leading heart specialists. They'll talk to you about diet, exercise, stress management, and maybe more importantly, the serious warning signs your body might be giving you. Along the way, you'll get to know the workings of your heart just a little bit better.
Sandy Freeman?
Yes.
Delivery.
Oh, how lovely. Thank you. I guess Cupid knows a thing or two about the subject.
My funny Valentine, sweet comic Valentine.
Think about how many songs have been written about the heart, like Heart and Soul, You Gotta Have Heart, Dear Heart. It's a wonder we don't take better care of the hearts within us. Today, with the outstanding medical advances made in recent years in the diagnosis, treatment, and prevention of heart disease, it's easier than ever to take good care of your heart. Let's take a look at a healthy heart. Doesn't look like a Valentine, does it? The heart is a pump, a miraculous pump, that beats 100,000 times a day. It pumps 2,000 gallons of blood a day, keeping it at the correct pressure through 60,000 miles of blood vessels. Every cell and every tissue in the body gets its share of oxygen and nutrients from the blood. The average blood cell makes a round trip through the circulatory system every 60 seconds, and at speeds of up to 10 miles an hour. The normal resting pulse is 60 to 80 beats. In a lifetime, this 7 to 12 ounce organ will beat over 2.5 billion times. The arteries carry oxygen-rich blood from the heart to the cells. Once the oxygen and nutrients have been deposited with the cells, the blood becomes oxygen poor and returns to the heart via the veins. Although gallons of blood flow through its chambers to be pumped to the body, the heart can't use the blood for its own use. The only way oxygenated blood can reach the heart is through the coronary arteries.
Every time your heart beats, it takes some of the blood being pumped through it and detours the blood back through these coronary arteries, moving it into the muscular walls of the heart. Herein lies the problem. The diameter of these arteries is only about 1/8 of an inch, very, very small. It doesn't take much for them to become clogged. The clogging is what's known as atherosclerosis. Think of a freeway with cars moving normally. Now picture that freeway at the beginning of rush hour. The buildup of congestion slows the cars down. An accident happens. Now, with so many cars on the road, almost no one can get through. Only 1 or 2 lanes might be moving. What clogs these tiny arteries is cholesterol.
That nasty C word, doctor. How does cholesterol get there in the first place?
Your body produces its own cholesterol, and that's quite normal. We run into a problem when our diet is rich in saturated fat and cholesterol. A high blood cholesterol is seriously linked to the incidence of heart attacks. Getting the cholesterol down can really make a difference. For every 1% drop in blood cholesterol, there's a 2% fall in the risk of heart disease. That's why it's a good idea to have your doctor test the cholesterol level.
Okay, so then we shouldn't be eating cholesterol.
Not so fast. Cholesterol isn't all bad. Actually, there are 2 kinds. The first type is high-density lipoproteins called HDLs, or good cholesterol. The other type usually involved in coronary heart disease is called low-density lipoprotein, commonly referred to as LDL, or bad cholesterol.
Do you know what an LDL is?
Yeah, as a matter of fact, I own one of them, and it gets terrible gas mileage.
An LDL sounds like someone's initials.
I have never heard of an LDL, no.
LDL cholesterol clogs arterial channels, and its level is sensitive to a diet high in saturated fat. HDL is the good cholesterol, and it's good for 2 reasons. They don't collect on artery walls to block blood flow, and they actually can remove LDLs from the bloodstream. The greater the percentage of HDLs in the blood, the more protection from coronary artery disease. HDL levels can be increased significantly with a regular program of aerobic exercise. It's recommended that everyone over 20 have their cholesterol level checked. If that level is elevated, it's a good idea to have your HDL and LDL levels checked. Sometimes stubbornly high cholesterol levels or high LDL levels run in families. These are usually not helped by diet, but can be helped by certain medications of which your doctor will be aware.
I know that all of you are aware of the association between cigarette smoking and lung cancer and emphysema, but I'd like you to be aware of the fact that the greatest risk of cigarette smoking is for the development of cardiovascular disease. This actually occurs for a number of different reasons. The nicotine that's in the cigarette smoke will increase your blood pressure and it will stimulate your heart to beat faster, so that if your normal resting heart rate is slow, then under the effects of the nicotine, that heart rate will increase. The nicotine also promotes clotting of the blood. The final reason it occurs is that the carbon monoxide actually competes with the oxygen in the blood, so that you deliver less oxygen to the tissues and the heart muscle. If this occurs in somebody who has arterial blockages, then there's less oxygen available to that damaged heart. All of this increased risk of cigarette smoking is equivalent to being massively overweight.
Blood pressure. Many people don't ask and don't want to know, but Dr. Bird, what is my blood pressure?
You're still alive, 110 over 70. That's generally considered a healthy reading. You may be calm now, but if my pressure were being taken in front of these cameras, I might be a little nervous, which means my blood pressure might be a little higher than usual. So if a person gets an unusually high reading, it's a good idea to repeat the test once or twice to ensure that the reading is accurate.
Most of us have heard about the relationship of high blood pressure and heart attacks. Now, what exactly is the connection?
When the blood pressure remains chronically elevated, the condition is called hypertension. This condition affects about 37 million Americans, and it's one of the main causes of heart attack. One of the effects of high blood pressure is that it produces a strain on the heart by requiring the heart to pump harder to deliver the required amount of blood to the body. In addition, if the elevated blood pressure is caused by stress, then that stress will increase the stickiness of a person's blood platelets, which promotes clotting. The possibility of blood clotting creates a higher potential of heart attack or stroke, particularly if artery blockages already exist. Blood pressure is expressed by two measurements. The first is your systolic pressure, measured when the heart beats. The second is your diastolic pressure, measured when the heart rests between beats. Systolic pressure is normally between 110 and 130. Diastolic pressure is normally between 70 and 80. Hence, a normal blood pressure is expressed as 110 over 70. Most professionals agree that any reading higher than 140 over 90 indicates hypertension.
What causes high blood pressure?
For some people, a high sodium diet raises blood pressure. The average American consumes about 15 pounds of salt a year, 20 to 30 times more than the body actually requires. This salt draws additional fluid into the circulatory system, increasing the total volume of blood. More volume in the same amount of space produces a strain on the heart muscle.
Well, so the point is that we have to get salt out of our diets, but so often we're not even aware of how much salt is in the food that we eat. How can we tell?
For prepared foods, a good rule of thumb is to consult the ingredients panel found on the bottom of the nutrition label. Ingredients are listed in descending order by weight. That means that the higher up on the list a sodium-containing ingredient is found, the higher the sodium in the product.
In addition to salt, there is another risk factor that results in high blood pressure. And perhaps that's even more deadly than salt. And that factor is stress. stress. Everyone has it, everyone knows about it. How do you handle it, and what makes you feel it?
Work, basically, just work.
Traffic. Work. I don't like to work.
In dealing with stress, research has found that there are two kinds of people in the world. We call them type A and type B personalities. Type A's are people who are always looking at the clock. They talk fast, walk fast, always bringing work home or staying at work late. When they go on a vacation, it's never all vacation. They're usually hankering for some business. They're highly competitive, controlled by the clock, overachievers who are never far from their work. As usual in this world, one person's stress is another person's pleasure. For instance, a type B would get the same things done, but without the harried feelings of a type A. Type B's see the half glass of water as half full rather than half empty, as the type A could. It all comes down to how a person perceives their situation rather than that situation itself. Type A's just put more pressure on themselves. They can't help it. And here at the clinic, we do help them. We've worked out ways to keep these type A's from doing emotional harm to themselves. We coax them into replacing the negative sensations, situations, and thought patterns with something positive, something they like and enjoy.
People, I'm gonna grow old sick in traffic. Move it, move it, move it. I'm never gonna get there in time.
For this woman, we've suggested she play her favorite music.
What? Yeah, just a second. What? Yeah, just a second. What? Yeah, it's here. What do you mean the envelope didn't arrive? I sent it last night. All right, calm down. Yo, give me a manager.
This man created a sense of calm by altering his environment.
Yeah, Harry. Yeah. Well, take it easy, Harry. It'll arrive shortly, yeah. Hello, Herb? Yeah, everything's going to be okay.
We all have a primitive survival mechanism that's built into every human. It's left over from the days when mankind was at the mercy of the elements. It's called the fight or flight response. And our bodies still experience this dramatic physiologic response today. But instead of, say, an attack by an animal in the wild, it could be set off by having to give a speech in front of a large audience. Your blood pressure rises, rerouting the blood from your skin and digestive organs to your muscles. Now remember, there's some kinds of high blood pressure not related to stress, but these are rare. Stress hormones also signal blood to clot more quickly in case you might be wounded. In people who have a more extreme cardiovascular response to stress, these responses can eventually damage your heart. Big stresses are linked to more frequent stress-related illnesses. But new research also shows that daily hassles can build up and lead to stress-related problems as well. Stress can actually lower a person's immunity, making your body more vulnerable to illness. We now know that stress is everyone's problem. And that's why today there are several self-help techniques that everyone can easily integrate into their daily life. One is exercise, which lets the body dispose of its pent-up tension. Studies now show that people who exercise regularly have lower blood pressure, healthier hearts, and cope with stress better. Another important technique is the relaxation response. It's a centuries-old technique that's recently been rediscovered. There are several ways to do it, including repeating a one-syllable word to yourself slowly with your eyes closed, concentrating on your breathing, visualizing a calm scene, or tensing and relaxing your muscles. Most preventive medicine physicians now recommend that people use the relaxation response twice a day for 15 to 20 minutes to keep your stress reservoir from overflowing.
years ago in America, heart disease was virtually unknown. What was different in our diet back then? I'm here with Margaret Nell Martin, a nutritionist, who is going to talk to us about a healthy heart diet.
It's true. We ate much less meat a century ago. Also, much less fat, sugar, salt, and processed food like white bread and canned foods. There was no fast food.
How did that affect our hearts?
Back then, most calories came from complex carbohydrates, naturally high in fiber, like vegetables and grain. Today, most of our calories come from fat and simple carbohydrates, like sugar and processed food. Trouble is, we now know that heart disease is linked to high levels of fat and cholesterol and not enough intake of complex carbohydrates and fiber.
What's our lesson for today?
Well, we prepared a little lunch.
Oh, this looks delicious. Thank you.
It's quick and simple. 1 pound of grilled salmon with 1 cup of skim milk, fresh fennel leaves, 1/2 fresh lemon, 1/2 fresh lime, and black pepper to taste.
So we don't have to be on such a stringent diet.
No, not at all. It's not only eating well, it's the idea of satisfying your taste and your physical need and your feelings of hunger, all at the same time.
When I wake up in the morning, I must have a cup of coffee. And I know that the caffeine isn't good for me.
It's okay to have a cup or two, but if you want more, just brew decaffeinated.
What about additional things that I love, like nuts? Would I really have to give all of those up too?
Pistachio and macadamia nuts should be avoided because they increase the cholesterol level, and they're in the saturated category. Also in the saturated category are cream, butter, ice cream, fatty meats, homogenized milk, and egg yolk. In the monosaturated category, those foods that don't affect the cholesterol one way or the other are cashew nuts, peanuts, olive oil, avocado, and etc. But in the polyunsaturated category, which reflects foods which create the least amount of cholesterol in the blood, we have walnuts, almonds, pecans, safflower oil, and fish. You have to think of your life in terms of substitutes. If you love ice cream, try to eat ice milk. Substitute whole milk with non-fat milk.
What about butter?
Switch from butter to margarine. Make sure if you're eating meat that you're eating lean meat. Instead of using salt, experiment with spices, herbs, lemon, wine, and vinegar. And always be on the lookout for sodium.
To eat well is to relearn your eating habits and still satisfy your taste. Healthy mind, healthy body, healthy heart.
Just what are the health prospects for the future of our young people? What are the risks? We know that if they don't learn a lesson from the poor lifestyle habits of men and women suffering from heart disease today, their prospects are very grim. Just what are the present risks? Every 20 seconds, someone in this country suffers a heart attack. People like you and people like me, Americans everywhere. That's 180 people every hour. 1.5 million people each year, the mortality rate of 10 Vietnam Wars. If you're a man who smokes more than a single pack of cigarettes a day, you have nearly 2 times the risk of heart attack than a man who doesn't smoke. If you're a man with a blood cholesterol level of 250 or greater, you have 3 times the risk of heart attack as a man with a cholesterol level below 200. By the age of 60, every 5th man and every 17th woman suffers a heart attack.
We often hear statistics referring to men. In the past, women have been less susceptible than men to heart disease. It was thought that female hormones protected women from atherosclerosis and heart attack until menopause. Indeed, the odds of a heart attack for a woman between the ages of 35 and 55 was 5 times less likely than a man. Now those odds are shrinking year by year. The reason? Smoking. Women are smoking more, and smoking is now the leading cause of heart disease.
So what can we do about these alarming statistics? We can put into practice everything that's been talked about on this program. Cut out the smoking. Eat healthy foods as if our lives depended on it. Get stress under control. Keep that blood pressure low. And get enough aerobic exercise. But when all precautions fail to keep a person's heart healthy, or when genetics simply dealt someone a bad hand, the result can be a heart attack. A heart attack occurs when the blood supply to some part of the heart is either severely restricted or cut off entirely. A heart attack frequently has symptoms or warning signs that let the victim know something is wrong. The most common sign is pain, here in the center of the chest. It is often described as a squeezing, crushing pain, uncomfortable pressure, the feeling as if an elephant is standing on your chest. The pain may radiate to the shoulders, down one or both arms, or up into the neck and jaw. Often people mistake the pain for indigestion. The important distinction is that heart attack pain lasts more than 2 minutes and does not go away. The pain may also be accompanied by sweating, nausea, or shortness of breath. When blood flow to the heart muscle is decreased, but not interrupted, the person may have chest pain called angina pectoris. It too is described as a squeezing, a pressing sensation under the breastbone similar to a heart attack. But this pain lasts only briefly. The pain results from atherosclerosis and narrowing of the arteries. This impedes the normal blood flow to a portion of the heart.
What if a person isn't sure where the chest pain is coming from?
If a person is uncomfortable or anxious about persistent pain, they should consult their physician or go to the nearest hospital emergency room. If it isn't a heart attack, it might very well be angina.
Isn't that one of the conditions that's helped by coronary bypass surgery?
That's right. And it's become a common and successful surgical procedure. What we do is take a blood vessel, most frequently a vein from the leg, and attach one end to the coronary artery beyond the obstruction, and the other end to the aorta, the main artery of the heart. 200,000 people a year have coronary bypass surgery. It relieves the pain an angina patient often suffers, which can be excruciating at times. This procedure is not a cure, mind you, but it does alleviate pain and can prolong life.
Dr. Frist, I've heard about a procedure called angioplasty. I understand that it's a non-surgical alternative to coronary bypass surgery. Can you tell us more about it?
In certain cases, an angioplasty is a wonderful alternative to bypass surgery. It might help a person put off surgery or even avoid it. It's even being used with increasing frequency to stop a heart attack in progress. A special catheter with a balloon at the end is inserted into a partially blocked blood vessel. As the balloon is inflated, it begins to press the excess fatty deposits flat up against the vessel walls. This makes the channel wider and allows the previously restricted blood to flow more freely. In many cases, the blood vessel can remain open for years.
You know, there's been a tremendous amount of media attention given to aspirin preventing a heart attack. What's it all about, Dr. Frist?
That's right, Sandy. And it's welcome news for those who already have heart disease, as well as for those trying to prevent its onset. Recently, studies reconfirmed earlier findings that an aspirin, taken every other day, does in fact reduce the risk of non-fatal heart attacks. Aspirin does this by inhibiting the formation of blood clots, which is often the last link that begins the heart attack scenario. However, we must remember that even though the use of aspirin appears to be of great benefit, it also can have serious side effects, like hemorrhage or stroke. In fact, if aspirin were being introduced today as a new drug, it would, in all likelihood, have to be classified as a prescription drug. Medical professionals stress that aspirin should be taken only under your doctor's care. So consult your physician, and remember, aspirin can never be a substitute for a low-fat diet, weight control, exercise, and not smoking.
After a person suffers a heart attack, one of the important parts of their recovery is participation in a cardiac rehabilitation program, generally made up of two components. The first deals with the physical therapy program, and the second is psychological therapy, which deals with the emotional issues surrounding the heart attack experience. It's designed to help the patients resume their previous lifestyles. Sometimes it takes many discussions with the patient and their families to help them to confront any fears and anxieties they may be harboring.
When I got home from the hospital, everyone was extremely protective of me because they thought I was going to die. But they were driving me crazy. They got nervous when I walked the dog, when I got up too fast, even when I watched Monday Night Football. They thought I'd get too excited. I know my family loves me and wants to protect me, but I have to begin living again. I can't coop myself up like an invalid. What's the good of surviving if I can't continue enjoying my life?
In addition to psychological counseling, the cardiac rehab program introduces exercise back into the patient's life with physical therapy. Our rehab program, and many others like it, first carefully evaluates an individual's performance on a treadmill or bicycle, and then designs a program tailored to each individual. The progress of each of the patients is then monitored closely. The healing process after a heart attack takes about 4 to 8 weeks. 30 or so years ago, heart attack patients were confined to bed rest in the hospital for the entire recovery period. They thought the heart would be jeopardized if any strain was put on it before it healed completely. However, modern studies show just the opposite to be true. Being immobilized for that length of time increases the risk of blood clots, besides weakening the body's muscles from inactivity. We now know that exercise improves blood flow, blood chemistry, blood pressure, and helps strengthen muscles weakened by bed rest. Exercise can enhance a patient's life not only by improving their physical comfort and well-being, but also by helping to dissipate general anxiety that a patient may have about their condition.
You and me, all of us everywhere have the power to make changes. Simple choices we've spoken about in this program. Simple ways to gain the power to take charge. It's time to begin your life again, not tomorrow, but today. For where your treasure is, there will your heart be also. Your treasure is your heart. Protect it, cherish it. Now don't go away, because in a moment Ann Kreiner, our physical trainer, will guide you through some visualization techniques and exercises to help strengthen your circulatory system. I'm Sandy Freeman, and it's been a pleasure to have been your host.
Welcome. I'd like you to start with your feet a little wider than your hips, abdominal muscles tight, pelvis tilted, shoulders reach. Last two. Last one. Right arm goes up, reaching up. Both arms press forward, press and pull. Reach up, right arm. 1, 2, 3. Last time, both arms press it forward and pull. Reach up. Both arms press it forward. Now adding feet, touch the toe. Feet apart, arms pressing forward. 1, and pull. 2, reach up. Reach. Both arms press forward. 1. And let's do it again. Now that we got it. And feet apart, press forward, stretch that upper back, warm up those shoulder joints and lift up. Press forward again. Last set, reaching, lifted, 1. Press it forward, press it front. Next time, let's bring those arms forward, hold them there, turn the palms up, pull elbows and reach. Bend those knees and reach. And lift. Again. 2 more. 1 more. Next time, come on down and stay here. Round that back, release. Round that back, release. Stretching out that low spine. Last set of 4. 3. 2 more. Last one. Feet together. Heel touch. 2, 3. Keep going. And with the arms, reach it front. 3. Toe touch to the side. Toe. Toe touch front. And take it side. Press it 1. And press it front. Touch it side. We're going to turn it into a heel touch. To the front, right foot forward. Hold that toe up. Nice deep stretch. Palms forward. Feet are close together if you have trouble with your balance. Bring the feet closer together. Sitting into the back leg. Drop the hands, step forward onto the front leg. Bring that weight with you. Abdominals are lifted. Relax the shoulders. Take a nice deep breath. If you will, tighten the muscles on the back side of the hip, tucking the pelvis under so we get a good stretch through those hip flexors on the front of the hip. Pull the feet together. Opposite leg forward, toe comes up. Arms press forward, stretching the upper back. Good. Relax the neck and shoulders. The tendency on this is to bring the shoulders to the ears. Keep them low. Drop the hands and bring the body weight forward, stretching into the back leg. Tuck the pelvis under so we get a good stretch right in the front of the hips. We'll use these muscles quite a bit in the aerobic section. Nice deep breath. Pull the feet together. Right arm reaches up. Reach straight for the ceiling. Come straight up. Reach back as if you were going to touch yourself on the back of the shoulder. Hold that stretch. Reach up. And drop the arm. Other side. Lift it up. Hold that stretch. Bring it up and drop the hand behind. Making sure the pelvis is tilted and the low back is protected at all times. And release. Bring the arm up. Bring it down. Shoulder forward. Stretching into the back. Release it. Change sides. And release and release the hands, pressing down low. We use the arms quite a bit in low impact aerobics to keep that heart rate right where it's supposed to be. Bring the arms all the way up. Nice deep breath. Step feet together. Hands behind the body. Stretching out the chest. Good. Bring it up once more. Exhale, drop the hands down, and here we go. Toe touch front. Good. Now we're going to take the feet a little wider apart, let that toe touch in front. Eight, 7, 6, 5, 4 more. Then we're going to touch to the inside of each foot, stepping side to side. Again, 4, 3, toe touch behind. Touch behind. 4 more. 4, 3, 2. Feet center, side to side. 4 more. 4, 3, 2. Touch across in front. Add arms. 4 more. 4, 3, 2. Feet center. 1. 4, 3. Toe touch behind again. 8, 7, 6. Keep the shoulders low and relaxed. And take it center. Touch it. 4 more. 4, 3. Now travel forward. Toe touch front. Stay here for 4, 3, 2. Touch behind and travel back. Stay here for 4. And travel forward for 1. Stay here and touch. And take it back again. Touch it. Stay here for 4. Feet apart. Plant them on the floor. Arms are staying. Good. 4, 3. And we're going to start to reach up with the arms. Left arm. Up and right. 4, 3. And reach it front. Alternating arms. Good. Really extend through the shoulders, keeping those abdominals nice and tight. Good. If you need to change the stance by bringing the legs closer together, you may do that also. It's a about you feeling good about the movements. 4 more. 4, 3, 2. Now overhead reach up, lift it. That's it, up 4, 3, 2. And front again. And overhead, lift it, reach it. And front, again. And overhead. We're gonna add some feet to this. Step side to side. Overhead, reach it. And again, reach front. And up, overhead. Last time. And up. We're going to change those arms. It's right arm swing. 4, 3, traveling right 2 steps. And left. Repeat it. Stay here for 8 touches. 8, 7, 6, 5, 4, 3. Really reach and extend with those arms. 2, right. And left. Again. Single touches. 8, 7, 6, 5, 4, 3, and to the right again. Again, repeat it. Stay here. Now you can intensify your movements by really reaching with those arms. 3, 2, right again. Again. Stay here. It goes. 8, 7, 6, 5, 4. Let's repeat this one more time. To the right. Right. Now left. Again. Stay here for 8, 7. Stay with this movement. For 4. Pull the arms in close to the body and reach it. For 4, 3. Changing those feet. We're going to lift the leg behind. For 4, 3, 2. Touch it, toe down. 1. 4 more. 4, 3, 2. Lift that leg behind. 1. 4, 3, 2, and 1. Step it. Let's set up. 4, 3, 2. Leg lift behind. 4, 3. Leave your right arm out and single arms. Yeah. Begin to use those muscles in the back, making them nice and strong. Help keep that posture good and tall. One thing I'd like you to do right now is to check your abdominal muscles. Are they contracted? Are you feeling supported and strong? 4 more. Same arms, touch the toes, side to side. 4, 3, 2. Lift that leg behind. Again for 4, 3, 2. Touch the toe. For 4, 3, 2. Have that leg again. Stay with this movement and change the arms. Swing them side to side. Let's set up. 4, 3. Drop those feet on the ground. Last time for 4, 3, 2. Now pull the arms in close and reach them up. Again, it's 8, 7, 6, 5, 4, 3. Pull those feet together. Toe. Good. Walk in place. Arms. Again, it's 4, 3, 2, 1. Drop the arms, bicep curls. Good. For 4, 3, 2, and 1. Keep it going. Nice deep breath. A nice deep breath. Keep those feet going and reach the arms up overhead. Pull. Again. Now I'm sure in aerobics you've seen a step called a crossover step. The one that you can't quite get your foot going in the same direction. We're going to show you how to do it. Drop the arms and keep them low and shake them out. It starts with a side touch that we've let you practice quite a bit. A side touch. Let's let the arms move a little bit. Yeah. Again. Good. So we've done this activity. Now I want you to feel comfortable with that side-to-side step. It goes 8, 7, 6, 5, 4, 3, and now we're going to move to the right 2 times. Again. Again. Now let's let the arms relax and let's pay attention to the feet. 2 more. Take it back. Now you're going to step across in front. Step across in front again. Not so hard. Knowing what to do. Step. Yeah, let's go for 4 more. 4, 3, 2, 1. Now let's add the arms. Good. Again. It's 4, 3, and 2. Now we're going to add a little knee lift next time. Here we go. Knee up. Good. Walk it to the side. If it needs to be, you can kick it low and make it feel good for you. The idea is to have fun, because it really is. Side. Whoa, yeah. 4 more. 3, 2. Back to side steps. Step. Good. Let's keep the feet simple, but let's intensify those arms. Take the arms and reach them up. Again, 8, 7, 6, 4, 3, 2. To the right 2 times. Again. Yeah, now if you need to, drop those arms to lower the intensity. Make it feel good. Side. Next time, we're going to step across. Good. Oh, yeah. Again. Side to side. Last time, add a knee lift. Again, side. And lift that knee. Oh, yeah. And now that you've got it, start to enjoy that movement. Take a good deep breath and get that oxygen moving to those muscles. 4, 3, 2, 1. Back to touches. Step. Let's change the arms. Reach them out. Again. 4, 3. Take it to the right. Take it right. And left. Again. Right. And left. Again. And right. That's 2. Cross it over. Good. Look, Ma, we're dancing. Again. Last 2 and across. And take it back. Add that knee lift. Again. Yeah. And lift. Woo! Check your abdominals, because every time you lift that knee, you're using the muscles in the lower part of your abdomen. And we want our posture to stay good and smooth. So take a good deep breath and tighten your stomach. And walk in place. Nice deep breath. Inhale, reach those arms and take it down. Last time. Right foot to a lunge, side step at 1. Good. Now pull the arms in. Let's work the back of the arms with the tricep extension. Yeah, now we're using all those large muscles in the legs, so that blood should be moving freely through that body. And when that's happening, you feel your body needing more oxygen. So feel yourself breathe. Nice deep breathing. Now take the arms front, reach. 4 more. 4, 3. Take the arms nice and low, press it. You've got it. 4 more. 3. Elbows up, press it. 5, 4, 8, 7, 6. Again, it's 4. Take it down nice and low, press it out. Start to really work those muscles in the upper body. 4, 3. Both arms press forward. Both arms, press them down. Now take them forward. Really feel those muscles in the upper body beginning to work. And press it. Again, come on. Press it down. And do a little bit of a change. 4 more. The feet are stationary, but the arms are the same. Press down. 2. Press it forward. Yeah, now press it up. Press front for 4, 4, 3, 2. Now take it down again. And press it front. This is the same movement we were doing a moment ago. Up. The difference is the legs are stationary. It's a little easier on the knees. And down again. Last time. And take it up. Step together. Now step touch in front. Take it to a little knee lift. 1. Arms, push them forward, press. Reach overhead. 4, 3. Push it front. And you've got those arms and legs moving at the same time. Up. You're more in high intensity. Front. So if you need to lower that intensity, drop the arms down now. Yeah. And front. Drop the arms again. Down low. Push it front. Last time down. Make it a low kick front with the arms pushing front. Again, press it. 4, 3, 2, knee lift and arms up. 4 more. It's 4, 3. Kick across, press it front, right across. 4 more. 4, 3, and overhead, lift it and reach. 4 more. 4, 3. Kick it across. We're going to stay with the legs down low for a minute. 4, 3. Touch that toe to the ground, low in front. It's 4, 3. Leave the feet apart and just upside. Good. 4. Changing arms back to tricep. Pull the arms in and press it out. Yes. And press it here. Yeah, really work those arms so we can get some firming action in that upper body. 4, 3, 2, 1. Inhale, reach it up. Exhale, press it down. Use those legs, reach up and down. Let the legs move. Reach up and down. Inhale up. And arms are out to the side. Lean into one leg. Reach up and pull it down for 2. Reach it up for 2. And down for 2. And up for 2. Notice the body stays in a nice straight line. Stay here. Press forward and stretch that shoulder. Nice deep breath. Check that body posture. Pull it in. One arm goes up. Stretch long. Slowly down. For 1 and 2. And reach. For 2 again. Pull it 1 and 2. Let those hands open out and really reach. Again. For 2. And reach. Again. Pull it down. Last time up. Pull it down. Bring the arm forward. And press it. Get a good stretch to the back of the shoulder. Check those abdominals. Keep that low back relaxed. Nice deep breath. Bring the hands down low. Pivot the body very slowly so that you get a good stretch. Push the heel toward the floor. Soften the back knee. And tighten the abdominals, feeling the hips pull under. You'll stretch out the front of that hip, the area we worked with those knee lifts. Nice deep breath. Pull the back leg in a little bit. Sink into that foot. Nice deep breath. Gently hold. Bring the body forward. Turn to the opposite direction. Press that heel long. Tilt the pelvis under. Feeling the stretch all in through those hip flexors. Nice and easy. Relax the shoulders now. Pull the back leg in a little bit. Sink into that back leg. Take a moment to bring that breathing back to normal with a good deep breath again. Exhale, bring the body forward. Bring the hands down the thighs. You're not too far forward. Round that back. And release the stretch. Round that back. And release that stretch. Round that back. And release the stretch. Again, last time. And release. Pull the feet in close together. Bring the right leg forward and bring the knee down to the floor very gently. Hand down to the floor. Bring your body down. Extend one leg out. One knee bent. Sit nice and tall. Turn toward the bent knee. And hug the knee toward the chest. Release. Other leg comes up. Extend. Turn. Shoulders are relaxed. Hold that stretch. You'll feel that stretch down in through the hip as well as into the low back. Nice and tall. Pull the legs in comfortably. Sit in a relaxed position. Shoulders are relaxed and down. Drop the chin to the chest, stretching out the back of the neck, area that we carry so much tension. Take a deep breath. Shrug your shoulders up to your ears. Exhale and release the shoulders. Inhale, lift the head and close the eyes. You can do this seated in a chair. You can do this at the office. You can do this relaxation anytime you feel the need. It takes approximately 20 seconds, but I'm going to talk you through it and teach you how to use this to release tension in your day. Sit comfortably in any chair. Relax the hands in the lap. Palms are soft. And close the eyes. With the eyes closed, take a deep breath. And on the exhalation, let the shoulders grow heavy and let the jaw relax. The jaw will release as the teeth unclench and the tongue relaxes in the mouth. Feel the eyelids grow soft. The muscles around the mouth relax. Visualize the number 10. As you count very slowly to yourself, inhale as you say the number, and exhale completely. On your next inhalation, count 9. Inhale deeply as you think the number 9. Exhale with the mind clear and smooth. As we continue the countdown, 8, with a deep inhalation and calming exhalation. Inhale with a 7. On the exhalation, relax on that breath. Don't rush the next breath. Feel the shoulders release, the hips relax. Inhale on 6. Exhale and think to yourself, arms and legs relax. Inhale on 5. Exhale and release the muscles in the fingers and toes. Inhale on 4. As you exhale, relax the tension in the abdomen. Inhale again. Exhale and release the chest and shoulders. Inhale on 2. Exhale. Release the point between your shoulder blades. Inhale on 1. With the eyes closed and released, relax your entire body and visualize the color pink. Allow it to enfold your body. Feel the soothing, relaxing. Allow the body to feel as if it were floating. If you wish at this point, you can visualize yourself floating in a boat on a lake, lying on a beach in the sand, sitting next to a cool waterfall, in a beautiful forest. At this point, you can use the 10-second countdown to release the mind and the body at any point during your day.